I went to Penn State University and I was looking for a position after I graduated, and a bunch of my friends were coming to Johns Hopkins. Of course, it had an excellent reputation then, and they were looking for nurses that were good, like technology, and would like those areas. So I started in surgical ICU and also on the medical ICU. That's how I ended up here. When I was there, I realized that even though the training was and the education that I had received was good, the bridge between what I graduated with and then how I would go to practice needed a lot of shoring up and a lot of other skills that nurses had to acquire. And then the second thing was I got bored after about 9 or 10 months in ICU because the patients never talked. And I love to listen to people and talk to people. And I decided my other favorite love when I was going through, my undergraduate was psych nursing. And to do a learning module or to get an important piece of information across, you had to do a project, you had to say it, you had to probably give a handout. Then we didn't have all the audio visual. This was in 1973 to 4. So that taught me so much, and it was so innovative. But I learned patience. I learned that you have to say it and do it in many ways. And I learned that there are no dumb questions. You have to be kind to everyone. And the ones that struck me the most were the ones who actually were doing this as the adjuncts, because they were in either the teaching environment or they were in businesses, and they were trying to get important concepts across to the adult learner. And I'm not disparaging other educational institutions. It's just the energy here, the standards of what they want from you but help you to achieve. I mean, it's not a punitive environment at all, but that's the kind of thing that Hopkins does. And everybody is here to help make you more excellent. I don't know if that is the right word, but certainly to encourage you to meet your goals.